And good afternoon, everyone. Thanks so much for joining us here for our first COVID-19 press briefing of the week. We have much to discuss in this ever-changing climate, and we have many guests with us here as well. Today, Orange County Mayor Jerry L. Demings will discuss the various vaccination sites, vaccination for the homebound, and those with a difficulty getting to our sites. The mayor will also discuss our COVID infection numbers, our positivity rates, and Orange Connects, our online mental health initiative. Orlando Mayor Buddy Dyer could not be here with us, but we do have epidemiologist Alvina Chu from the Florida Department of Health to discuss details on the vaccination process as well as COVID-19 numbers trending in our area. We begin with Mayor Demings. Mayor?
Thank you, Dr. Williamson. Thank you to all of you for joining us here today. I brought back up, we have Orange County Commissioner Victoria Siplin with us and Orange County Commissioner Myra Uribe. And if there are any questions in Spanish or Creole, we have today Ms. Ilia Torres who will assist with the Spanish translation, and we're going to toss it to Commissioner Siplin if there are any questions in Creole. How about that? So with that, we're going to begin. We have had a busy weekend so far with everything that has been going on in our community. Orange County is working hard to get COVID-19 shots into the arms of as many people as possible. On Saturday, the convention center site surpassed the 150,000 milestone for vaccines administered. We are now expanding to 3,100 vaccinations a day at our convention center, and there is a huge demand for wanting to get vaccinated. This morning, the vaccination appointment portal opened for anyone 40 years of age and older for the convention center site only. 7,000 appointments were filled within 13 minutes. If you didn't get an appointment, there will be other opportunities in the near future. Stay tuned to our news conferences, web pages, and social media, and we will make an announcement as soon as we get word from the Florida Department of Health in Orange County and our other various inventory suppliers. Please remember that you cannot just show up at the convention center for a vaccination. You must have an appointment at that site. Now, each week we try to begin with giving you the goals for the week. And so there are 4 goals that we have, and our goal is to stop the spread of the coronavirus. So the number 1 goal is to make the vaccine available to more residents within our county. Number 2, to make sure homebound residents have a chance to get vaccinated. We'll be talking about that in just a few moments. And number 3, continue to offer free testing within our county. And 4th, to help those with mental health related issues, perhaps caused by the pandemic. So I want to mention to you that earlier today, a message went out from me via the Everbridge system, which is similar to a reverse 911 system, in which we sent messages out to some 10,000 homes in the Pine Hills area. Starting tomorrow, we will be partnering with state officials to get the vaccine out in the underserved communities in Orange County. We want more seniors to get the vaccine. We will have teams of canvassers and firefighter paramedic personnel numbering about 150 of them collectively will be out in the Pine Hills and Lockhart areas of Orange County. They will be ringing doorbells and checking to see if there are homebound individuals who would like to get the COVID-19 shot. Those individuals for this purpose must be 50 years of age or older, in that the supply is being provided by the state of Florida. If the homebound person agrees, the canvasser will register. The Orange County Fire Rescue paramedics will then administer the shot to the individual. I'm going to ask some of the individuals who have joined us today to stand in just a few moments, but we have the Director of Outreach Services for the state, Ben, is here, and Deputy Director Terry. If you all just wave your hands. These are 2 individuals that the Florida Department of Emergency Management have assigned here to help run the program. The canvassers will be wearing a shirt that is either bright blue, green, or red. So I'm going to ask the canvassers, if you will stand at this time, I want people to see what they will look like when they're in the neighborhood. So turn around for the camera so they can see you. All right. The shirt will say State Emergency Response Team, or CERT. Each canvasser will have a picture identification, and you can see the lanyards around their neck with the photographs on it. In addition, Orange County Battalion Chiefs Renee Stone and Scott Egan are here. Chiefs, if y'all will stand as well. They are helping to ensure that the logistics are worked out when our canvassers and our paramedics are out in the neighborhoods. They will be available after our briefing to talk with the media should you have any questions. Thank you all for joining us today. You may be seated at this time. In the future, canvassers will also be going door to door in the Rosemont area, so please be on the lookout for these canvassers. We're proud to be working in partnership with the state to help homebound residents ages 50 and up with getting vaccinated. If you visit our website at ocfl.net/vaccine, you can find out about all the FEMA vaccination sites currently available. And the good news is there's currently a number of them. Eligibility at these FEMA sites align with the governor's executive order, meaning you must be 50 years of age or older or fall under the state guidelines for eligibility. I'm pleased to announce a new COVID-19 vaccination site at the South Trail Library branch located at 4600 South Orange Blossom Trail. Likely, this site will be in place for the next 6 weeks or longer and will be considered a state vaccine site. This new vaccine site opened today and is running 7 days per week between the hours of 9 a.m. and 7 p.m. or until the supply runs out. We are told this site will run again for the next 6 to 10 weeks while vaccine supplies last. At the South Orange Youth Complex, there is another federal FEMA satellite site running through tomorrow between the hours of 9 a.m. to 5 p.m. At that site, no appointments are necessary. Again, that is a federal site. And the FEMA Hub site, again, a federal site, continues to run 7 days per week between the hours of 7 a.m. and 7 p.m. at Valencia's West Campus. We are thankful to FEMA for their partnership in offering convenient vaccination sites throughout our community. In addition to these sites, obviously the retail pharmacy sites are also offering vaccination. Those are your CVS pharmacies, the Walgreens, et cetera. There are also free rides for anyone 60 and up who needs transportation to vaccination sites. You can call 311 and arrange a free ride through links to the FEMA site or to the convention site if you have an appointment. Again, this is for individuals 60 years of old or older who need transportation because of some type of health-related affirmative. Since the start of the pandemic, 120,412 cases of the coronavirus have been reported in Orange County. The disease still remains a threat. There have been 1,169 residents who have died of the novel coronavirus we know as COVID-19. Our 14-day positivity rate has been holding steady for the past week at about 5.2%. You're going to hear more about the numbers from Ms. Alvina Chu with the Florida Department of Health in Orange County. There is still free coronavirus testing being done at Barnett Park 7 days a week between the hours of 9 a.m. to 5 p.m. At this point, we will go through at least March the 31st. The past year has created hardships for our residents and has affected the mental health of many of them. The CDC estimates that as a result of the pandemic, there has been a 31% increase in anxiety and depression, a 26% increase in stress-related symptoms, and a 13% increase in substance abuse. I announced last week that Orange County has launched Orange Connects, which is an online mental health initiative and is completely confidential. Orange Connects helps connect our residents and their emotional needs with behavioral health providers and services. If you or someone you know is struggling, there are many types of support, treatments, and other options available to them through our Orange Connects program. Your mental health does matter. You can go to ocfl.net/Orange Connects or go to orangeconnects.com for more information. And with that, I'm going to turn it over to Ms. Alvina Chu, the epidemiologist from the Department of Health here in Orange County. And Ms. Chu, you're recognized.
Thank you. Thank you, Mayor Demings. As the mayor had mentioned, the Orange County has seen 120,412 positive cases. This is as of today at 1 p.m. Our current recovery rate remains at 97%, and our 14-day rolling percent positivity rate is 5.2%. Since the last time we spoke, we've had, unfortunately, 11 additional COVID-19 related deaths reported to us in Orange County residents. The age range of these deaths were 51 to 93 years old with a median age of 79. Our condolences go out to the families for their loss. 5 of these deaths were in females, 6 deaths were in males, 2 were in Asian, 3 were Black, and 6 were white. 2 were Hispanic and 9 were non-Hispanic. 6 had known underlying health conditions and 5 had no known underlying health conditions. 6 dates of death are from February and 5 dates of death are from March. 4 of the 11, or 36%, were reported from a long-term care facility residential address. Since the last time we've spoken, we had 2 additional B117 variant cases identified in Orange County residents, and that brings our current total of these COVID variant cases to 21. The age ranges of these cases are 15 to 84 with a median age of 31 years. The dates of infection were from January 18th to February 27th. 2 of the 21 had known travel, 11 had no known travel, 8 had an unknown travel history. 9 of the 21 had known contact with a confirmed case. There are no known deaths or hospitalizations associated with these variant cases. As the mayor mentioned, this morning within 13 minutes of opening the portal for COVID-19 vaccine at the Orange County Convention Center, we booked 7,000 COVID-19 appointments within 13 minutes. We'll keep you updated when the next round of appointments opens for our Orange County Convention Center vaccination event. To be ready for the next appointment opportunity, we encourage you to visit the CDR Health Pro website to create an account ahead of time. The web address is www.patientportalfl.com. If you need to cancel an appointment, please log on to your CDR Health Pro account and cancel your appointment so that others can take advantage of the vaccine. As of March 21, we've had a total of 386,122 doses administered at the site. 337,279 were administered to Orange County residents. We've administered 253,385 doses to persons aged 65 years and older. And we've had 118,368 Orange County residents with the vaccine series completed for 8.36%. For those residents who are 60 plus receiving 1 or more doses, it's 137,945 or 61%. So we're optimistic that as we can increase the capacity in our county, that we can get a handle on the pandemic. And as a precaution until that happens, until we can build the community immunity, we'd like to encourage everyone to continue practicing good pandemic precautions, especially with this increased time of travel. And, you know, spring break is upon us, along with a lot of travelers and visitors. And so please remember to continue until we get a handle on this to wear your mask, watch your distance, and wash your hands. And I'd be happy to take any questions later. And I'll turn it back over to Mayor Demings.
All right, thank you, Ms. Chu. We also have Commissioner Maribel Gomez-Cordero, who has joined us now. She can assist with the Spanish translation if necessary as well. So with that, we'll open it up for any questions that you may have.
Mayor Diamonds, this question is for you. This is Emily Braun with News 13. Have you at this point faced any backlash for moving in a different direction from the state's vaccine eligibility? And is there a chance that that backlash could mean challenges for people aged 40 to 50 who want to get the vaccine in the future?
I'm not sure how you define backlash, but I'm going to say no. At the end of the day, I do believe that the governor's goal is to increase the number of people who are vaccinated within the state of Florida. And so my goal is to ensure that that happens within Orange County. You heard that some 7,000 appointments were made within 13 minutes. So that speaks to the demand. For the last several weeks, we had not reached our maximum capacity at the Orange County Convention Center. So the fact that when we open it up today, we were able to reach that capacity, that's good news. We are approaching some nearly 70% of our seniors who have been vaccinated within Orange County, which means that there's going to be a natural slowdown, I think, at some point. Not 100% of our seniors are going to want to get vaccinated first, and we're doing outreach to try to get that number up. But in addition, there's an overwhelming demand for wanting to get vaccinated by the entire community. So today I received requests via email from the postal carriers saying, include us. Those who work in the hospitality industry said, include us. And then various other subgroups of workforce within our community want to get vaccinated. Well, I think it's a responsible thing to have increased the potential eligible pool of individuals to 40 years old. It's a measured approach that we have used, and I would not expect that there would be any type of retribution or backlash, as you would put it, because we're making decisions to protect the people in our county. I don't know how you can argue with that. That's my goal. It's not a political goal. It's not a partisan goal. It's about getting our county vaccinated as quickly as we can. Okay.
Mayor Lauren Seabrook, Channel 9. Following up on that, it did sound like the governor had some words for you through the media about your decision. I'm just curious if he reached out to you personally or if anyone in his administration has reached out to you.
No, the governor isn't going to do that. I mean, you know, those are just words that he's using, so we'll move beyond that. Again, my goal here is to not make this a personal issue. This is about the life, health, and safety of individuals in our community. So I'm going to stay there. I'll always take the high road. It doesn't mean that I won't disagree with strategies that the governor may use. In fact, I want you to think about something. Up until recently, it was the state of Florida, it was the governor that controlled which sites were selected for distribution of vaccination within our state. With very little input from local governments. He certainly had very little input from here. So when we see the numbers not being what we desired them to be, who's responsible for that? Am I responsible when I didn't choose the sites or the locations? That, I heard the governor in his response, kind of retort that Orange County was at 63% for the vaccination of seniors. Well, our numbers are slightly higher than that, but irrespective of that, at the end of the day, if our numbers are below what it is in other counties, it's because of the decisions that were made somewhere else other than here about where the vaccination sites would be located, not here. When you involve the local government officials, elected officials in the process, I believe you get a better outcome. I can say that objectively because I know this community. I was born and raised here. I know every nook and cranny of it. And therefore, because of relationships, I believe I have a better feel, just like every other local official, for what is best for their local community than someone who governs from another location. So my passion here is not meant to be at odds with the governor. It is to move the governor in a direction to do what I believe is the right thing for the people of our community. And I'm going to continue to do that. I will not be apologetic about that. I'm going to continue to use the experience that I have now of having been a public servant for 40 years in various capacities in this community and some pretty significant roles over time. And so one thing that I've learned is how to manage a crisis, and I'm going to continue to do that. Long way to answer y'all's questions, but that way you won't ask me another question about it. You know, I'm going to get it all out while I can. All right, where's the mic?
Thanks, Mayor Demings. It's Sam from Fox 35. So with all those appointments being snagged in 13 minutes, are you guys seeing a lot of out-of-towners, a lot of people who are not residents of Orange County getting those appointments, and do you see that as an issue?
The devil's in the details. We'll have to see. At this point, our convention site has been doing vaccination for weeks now. We haven't seen the vaccine tourism really occurring. There have been some who have come from other places here, but at the same time that the supply of vaccine is increasing here within Orange County, it's increasing throughout the state of Florida. So I don't believe that that is necessary. In fact, the available vaccine inventory is increasing for the entire nation. So I think that as we see more vaccine inventory becoming available across the country, here within Florida, here within Central Florida, it would negate any reason for people to have to travel long distances just to come here to get vaccinated. But what I do know is the people here want to get vaccinated. You know, my office received a plethora of emails from those who are in the new category, but also from 65-plus-year-olds who were thankful that we lowered the age to 40 at our convention center site. I fall in the upper category, and I, like many people in my age group, just believe that we are all better off if we get vaccinated. When we see the highest numbers of new cases, they're happening within younger adults who then take it back to their multi-generational homes and they spread it to other people. And so because of that, it's really important. Here we are in a period of time of spring break. And spring break is certainly, you see the calamities happening down in Miami-Dade County and South Florida with the spring breakers who are not following the CDC guidelines, and time will tell the results of what is happening there on the rest of us. So I think with being a #1 tourist destination where people come into our area, it's really important that we get our population inoculated sooner than later.
Nikki Zazzo with News 6. This question is for Mayor Demings. Along the lines of the previous question, would you recommend that area counties kind of follow suit with this new priority group, because there are many Orange County residents who feel like, you know what, because people are coming in from Lake or Osceola, that's kind of taking up appointments that would benefit people here locally. What would you say to that?
I'm going to leave it up to those counties. I believe that they know their counties best, and they have to look at their own experience to make decisions. So I do have a regional call on a regular basis with Seminole, Osceola, and Lake counties, and we talk about our various strategies, and we try to be consistent here within the region. But it's up to those counties to make decisions on behalf of their counties.
Buenas tardes, pregunta en español de Telemundo 31. Buenas tardes. En primer lugar, ¿existe temor de una nueva ola de contagios de COVID? El fin de semana estuvo los parques abarrotados al límite de su máxima capacidad. Segunda pregunta, ¿hará caso el mayor Demings al gobernador Ron DeSantis? Él recomienda, según su última conferencia el viernes, que el condado Orange está por debajo del promedio estatal en personas de la tercera edad vacunadas. O sea, en clara crítica a que hoy aquí en el condado inició la vacunación a mayores de 40 años. Pregunto, ¿va a hacer caso a esta recomendación del gobernador DeSantis? Gracias.
All right. There are two questions. The first question being, there's a threat of a new COVID-19 wave. We have seen parks at capacity over this past spring break. Are you concerned about this a potential of a new threat? And the second question is regarding Governor DeSantis' criticism about lowering the age range for vaccination at the Orange County Convention Center. He indicates that we are underneath the average for other counties in terms of vaccination for the elders. Are you going to follow his advice in that regards?
Well, the last question, I already addressed it, and I'll just leave it at that with that question. In terms of new sites that we will be opening, it is our goal to increase the availability of the vaccine throughout the entire county. I will admit that in terms of the demographics, the data indicates that in minority populations, we have fallen behind in terms of the percentage of those who have been vaccinated. But we're trying to, forgot.
I got you. Con relación a la segunda pregunta sobre la opinión el gobernador DeSantis, el alcalde ya había respondido a esa respuesta en detalle, por lo que no va a abundar más. Con relación a la otra pregunta sobre centros de vacunación, ciertamente indica que hay una baja participación con relación a comunidades minoritarias, pero que su interés siempre ha sido expandir las opciones de vacunación a otros áreas o centros en otras comunidades.
We are working with the state on the various spoke sites and the federal government to make certain that we strategically locate those sites in underserved communities.
Estamos trabajando con el gobierno estatal y federal para ubicar centros de vacunación en áreas que son tradicionalmente no representadas, en áreas, comunidades desventajadas.
We are using census data, census tracts, and data about the current persons who have been vaccinated to kind of laser focus where we will send our paramedics and the canvassers out to provide homebound vaccinations.
Hemos utilizado data del censo, así como también data de las personas que ya han recibido la vacuna para delinear nuestra estrategia que estamos siguiendo con nuestro cuerpo de bomberos en llevar las vacunas a aquellas personas encamadas o que no pueden salir de sus hogares.
Many of the canvassers that you see here today, they're fluent in English, Creole, and Spanish.
Parte del equipo que ve acá, que compone el equipo de canvassers, manejan varios idiomas, incluidos inglés, español y criollo haitiano.
So I look forward to working with the state to increase the level of vaccinations within our community.
Pero con interés trabajar con el Estado para aumentar nuestros niveles de vacunación en nuestra comunidad.
Muchas gracias.
All right, Melissa Thomas with Florida National News. So piggybacking off of what you shared with us about the canvassers and that program, do you guys already have, and forgive me if you already mentioned this, we just want to make sure, but have you guys already laid out specific goals and timelines in terms of the number of people you want, the number of older individuals you want vaccinated per week with the canvassers? Have you guys already nailed that down?
Yes. We're not sure what the demand will be for that, but the goal is to increase our outreach to those who are homebound. Not everybody can get to the convention center, et cetera. Some people perhaps will say that they don't have transportation, and so we're going to take it into their communities. And this is something that had been tested down in South Florida. We are trying to perfect the model that they use in South Florida. We're working with some of our local elected officials to help identify persons that we will be able to contact during this next few days. And we are dependent on you, the media, to help us get the words out. We are basing this on the social vulnerability index scores. Those are scores that indicate where there are inequities with access to the vaccine. So we're trying to level that playing field here at the local level.
This question's for Mayor Demings and also maybe for Alvina. This is Steve Hudak from the Sentinel. Mr. Mayor, you make a good point that postal workers have contacted you, hospitality industry folks, theme park workers are concerned. They all have a good case for getting vaccinated because they're going to be frontline people. They're in front of people all the time. So I guess I would ask this: how do you try to get those shots into the arms of those folks, many of whom are very young, and I mean, they're under the age of 40. So how do you still try to keep the guidelines in place, yet serve these people who are at risk?
Well, the good news is that the President of the United States says that he wants all Americans who are adults to have access to the vaccine by May 1. So that's a month or so away. That means that the supply will have to increase significantly. You know, his commitment was that within his first 100 days, they would have given 100 million doses of the vaccine. I think at day 60 or so, they already reached that mark. So I'm highly encouraged by the manufacturing of vaccine, the Johnson & Johnson that is now within our community. It gives us the opportunity if we contact someone who wants to be vaccinated through this homebound program, we're able to give them one shot. It's one and done, and we don't have to go back to that person again. So all of that is helpful, I think, in our long-term strategy to get up to that 79 or 80% pinnacle that healthcare experts say we need to reach. Ms. Chu, we are currently, in terms of Orange County's 1.4 million population, what percentage of our population has been vaccinated at this point?
The 8.36% of Orange County residents have completed a vaccine series.
Okay, so you can see at 8-point-something%, that's all residents. We have a long way to go. When we look at those, I'm going to say 50 years and older, or 60, what percentage of our population has received at least one dose who are 60 and older?
61.03%.
Okay.
Of Orange County residents.
So that's better than 60+% of those 60+, you know, people like me fall into that category. But we want to see everybody have access. I look out in the audience today, some of you are probably in that 40 category or younger. And if you're not a firefighter, paramedic, you're not a law enforcement officer, a healthcare worker, if offered the opportunity, would you take the vaccine to keep it from spreading within your family or your household? That's a personal decision that you will have to make. But we want to make certain that we are at least offering you that opportunity.
This next question comes in from Sierra Putman with WFTV. It's for Scott Howitt in the schools. Her question reads, when the CDC announced social distancing in schools could be reduced to 3 feet, did that change how the district sets up classrooms, or were some students sitting 3 feet apart already?
Well, as you know, the CDC guidelines are recommendations, and we currently don't have any plans to change our current practice, which is outlined in the health and safety manual of the district, which says we're going to maintain maximum distance of 6 feet when feasible. And when feasible has always been the instruction of the Florida Department of Education, so we're going to continue to follow those. We do have a mandatory mask mandate still for all students and staff, which we're continuing to follow. And we do know that our COVID-19 infection rates for for the school district remain low compared to the general population throughout the community. So we think that what we're doing is working and will continue to work. We'll look at the 3 feet distancing, obviously as a guideline, and take that into consideration, but we're going to continue to do maximum separation up to 6 feet as long as possible. Thank you.
Thank you. This next question comes in from Asher Wildman from News 13 from Mayor Demings. His question reads, Mayor Demings, you have said your goal is to vaccinate 5,000 a day at the convention center. How can you do that with only 18,000 doses a week? Is there a stockpile of doses, or is the county expecting their normal allotment to increase to 30,000 a week soon?
I do expect our allotment to increase, and I do expect the total inventory available within our community to increase. One of the numbers that we don't readily have is the number of doses that is being provided through our retail pharmacies. There are thousands of doses coming into our community, and we, at this point, perhaps the state has those numbers, but we are not adequately capturing that from the local level. It is estimated, I think Dr. Pino says, that probably 4 to 5% of our veteran population is here being vaccinated as well. So our numbers are probably slightly lower because that is all part of the federal cash, and as a result, it's not really being captured at the state level in the numbers that are being reflected here. So we know our numbers of people who likely have been vaccinated in our county are more than what you hear being reported at this time.
This next question comes for you, Mayor Demings, from Gabrielle Roustone from the Orlando Sentinel. Her question reads, will Mayor Demings put theme park and hospitality workers on the priority list to get vaccinated at the convention center? If not, what does he think those tourism workers of all ages will be, when they will be able to get the shot?
With the 3-week availability that we are aware of at this point, I couldn't do that because I don't control the vaccine inventory or supply. It's controlled primarily by the federal government and allocated within the states, allocated within to our local communities, our community health centers. I didn't talk about them earlier, but there are some initiatives of our federally qualified community health centers. These are centers that have been pre-qualified by the federal government to reach underserved communities. They are receiving direct allocations of the federal supply that doesn't go through the state. We have not adequately captured those numbers either, but there are different initiatives from True Health to Orange Blossom health centers that are also inoculating people within our community. You hear about different small pods that they are working with. Typically, they are given anywhere from 250 to 500 doses at each one of their pods, and there are multiple ones of those events that are occurring almost on a daily basis as well. So what we're seeing is a significant increase in the throughput of the opportunity to get vaccinated within our community.
This next question is going to require translation for Spanish. It comes in from Jennifer Marcial from El Sentinel for Mayor Demings. Her question reads, we keep getting videos and messages of clubs in downtown Orlando being packed every weekend. There is no sense of social distance, nobody has masks, and they seem to be fully booked, no limit of attendance. People are questioning what is the county and the city doing in order to prevent this, if anything. Can there be any actions taken with the venues?
We are continuing to do our inspections. I think we are up to approximately 9,700 inspections that have been done in various businesses. Our compliance teams were out again this weekend. Tim Bodick, you can come on up and kind of respond to what we saw from that inspection experience.
Con relación a la pregunta, el alcalde enfatiza que continuamos comprometidos con realizar las inspecciones de parte de nuestro equipo de cumplimiento. Se han realizado 9.700 inspecciones y este fin de semana estuvimos visitando ciertos negocios. Invitamos a Team Bowling para que nos dé una actualización al respecto.
I think what we've started from the beginning is we've had a partnership with the City of Orlando's Downtown Development Board.
They're going to translate in Spanish, too.
Okay.
Go ahead. We've worked with them and come together in terms of trying to educate those downtown businesses. I know they've done a lot to help a lot of those businesses out. We've been down there as well to help them. We understand that there's always a few that they continue to not comply, and we continue to follow up on those and try to educate and encourage them back into compliance.
Desde el inicio establecimos una alianza con la ciudad de Orlando en la que visitamos negocios en el corredor de Downtown. Nuestra meta siempre ha sido educar a esos dueños de negocios para que adopten prácticas responsables. Siempre vamos a encontrar negocios que no estén en cumplimiento, pero nuestra meta es regresar a los negocios para obtener voluntariamente el cumplimiento de los mismos.
I would also encourage them to send their complaints to the state. If they're alcohol and beverage license establishment, then they're regulated by the Division of Professional Regulations and Alcohol and Beverage. And the state fines are still in place pursuant to the governor's executive order.
La exhortación es a que si usted experimenta negocios que no están en cumplimiento, que tramite su queja o que la reporte directamente al Estado, especialmente aquellos negocios que tienen licencias de alcohol. Ellos están regidos por el Estado y el Estado tiene la autoridad de imponer multas por violaciones.
Question comes from Ryan Lynch with the Orlando Business Journal for Mayor Demings. What kind of updates do you have on the planning for the new federal funds the county plans to receive?
We are still awaiting the final instructions from the U.S. Treasury Department before we can make final plans. Maybe one more question?
Hi, Mayor Demings. I think this could be for you and for Alvina as well. But I'm curious if we know what kind of access undocumented immigrants have had to the vaccine so far. I'm not sure if we have any sort of ballpark that we can conceptualize that in any way. And then specifically for Mayor Demings, as you mentioned, that Orange County has not seen any widespread vaccine tourism. And that seemed to be the logic behind the proof of residency requirements, which obviously could limit access for undocumented immigrants who don't have driver's licenses and Florida ID. Do you think we still need that residency requirement as the supply of the vaccine increases?
Okay, I'll let Ms. Hsu take the first crack at it.
So we don't specifically have any numbers about undocumented persons who have received the vaccine, but we have been working with the county partners to identify areas of social vulnerability and also with low vaccination rates and also high death rates to try to get vaccine into those communities that are most severely affected. And so that would not preclude someone from getting vaccine if they were able to come to a community site that is not at the Orange County Convention Center.
I do believe that as the inventory increases, we will look to form partnerships with some of our various consul offices here within our community to do outreach that could include undocumented persons. However, we don't control the supply or typically the eligibility criteria that's typically controlled by the federal government. or the state. Okay, with that, let me just say thank you to all of you for being here this afternoon. Hopefully this was informative. Our next briefing will be scheduled for Thursday at 4:30 p.m. We'll see you then.